Hello, greetings everybody. I welcome you all to my video today. I'm still treating malaria in pregnancy, okay? So let's look at some cycle of the malaria parasites. The cycle goes like this. Uninfected mosquito, when it bites an infected person, after suckling the parasite from the body of the infected person, and that mosquito has gone to bite another person who is not infected, the infected mosquito end up transmitting the parasite, the malaria parasite, into the body of the other person. And when the malaria parasite gets into the body of the other person, the malaria parasite travels to the liver of the person, and the parasite stays there. When it gets matured, it travels down into the person's body and then into the bloodstream and starts feeding on what? The red blood cells. And when that happens, the person starts showing malaria symptoms. Okay, I mentioned some symptoms of malaria in my first video. Okay, so the person starts showing symptoms of malaria. Okay, so the question is, let's look at who is at risk of malaria. The people who are at risk of malaria are travelers coming from areas where there is no malaria, also pregnant women, okay, pregnant women and their unborn children. We have older adults, and then we have what? Young children and infants. These are the categories of people who are at risk of what? Malaria infection. But then let's look at some risk factors. I've mentioned who are at risk. And this one, these are risk factors of malaria infection. When we say these risk factors of malaria infection, is the most risk factors, the most risk factors is to live in areas where the disease is common. Okay, risk factors, living in a place where the disease is common. Okay, so living in a place where the disease is common, we are looking at the tropical and then the subtropical regions. Okay, so when we are talking about the tropical and then the subtropical regions, we have sub-Sahara Africa, we have the South and then the Southeast Asia, we have the Central America and then the Northern South America. These are the regions, these are tropical and then the subtropical regions where the malaria is so common and severe. Okay, so somebody will ask, what is the role of a midwife in the prevention of what? Malaria. Yes, the midwife has a role to play as a professional in dealing or handling pregnant women. The role of a midwife in prevention of malaria is to administer the IPTP in the second and in the third trimester to the pregnant woman. Okay, administering the IPT treatment to the woman in the second and then the third trimester of pregnancy, and that is the right dose and then at the right time. Okay, when I say right dosage, you give the appropriate dosage that is supposed to take at the right time, that is from the second trimester to the third trimester. Okay, you administer those IPT treatment to them, and those are the role the midwife play in ensuring that the pregnant woman doesn't get the infection of what? Malaria. And then some of these IPT treatment, we do it based on sometimes in some cases some people react to this IPT treatment. So when their GCPD status is reactive, sometimes we exclude them from not taking it. But some school of thought too is saying that all of them, whether reactive or not reactive, they should all take it. So this is the role the midwife play. The midwife administer IPT treatment in the second and the third trimester of pregnancy. That is the role a midwife play. Okay, in ensuring that my pregnant woman doesn't get infected with malaria infection. Okay. So someone will ask, what are some of the effects malaria infection have on the pregnant woman? There are so many effects malaria infection will have on the woman. One, the woman may have severe anemia. She will experience severe anemia. She might experience miscarriage, that is spontaneous abortion. She might experience premature delivery. Okay, premature delivery, and then there might be delivery of low birth weight baby. These are some of the effects of malaria infection on the woman. I hope you are following me and then listening carefully to all that I'm saying. I in this video I mentioned to you who is at risk of malaria infection. I mentioned them. I mentioned some risk factors also of malaria, and I also made mention of the role of a midwife in the prevention of what malaria treatment. Okay, in the prevention of malaria in a pregnant woman. Okay, so in upcoming video, I will solely treat or bring to you the prevention of malaria and then the treatment of malaria to you. Until then, have a good day. But please don't just watch without liking and commenting or sharing. After you watch my video, please like, share, comment, and then tap on the link. It will take you to my YouTube channel. You go there and like my video and watch. After watching, you subscribe to my YouTube channel and keep receiving updates on the subsequent or the upcoming health education. Until then, thank you for listening and have a good day.